Welcome back. This is part two in HopeCore's response to the current coronavirus epidemic in Kenya. And I have very good news to report. In the last 2 days, because of the generosity of our staff and the great generosity of the foundations that we have worked with for so many years, that have shown tremendous confidence in us, I've been able to put together a war chest of what now is totaling about $27,000 US to fight the epidemic. $27,000 US. Now, throwing money at this epidemic will not stop it, but that money is absolutely critical for HopeCore to respond to what is going to be needed in the coming months. We're going to need money for tanks, we're going to need money for soap, money for posters, money for banners, money for petrol to get our people into the field, etc., etc. So we, in 48 hours, are much stronger in this fight than we've ever been before. So what is today about? Today is about one thing, and that is we already know about what we're preparing for the stages, which is basically a coronavirus prevention station, and how we're going to talk about preventing aerosol spread as well as surface contamination spread of the virus. But what I am focusing on this video is the meeting that will be held this Monday that Naomi and Achesa will go to from the Department of Health and Public Health that will ask us then to take a role in the public health fight against this epidemic, and more importantly, a leadership role. And the reason I went out and focused on getting this war chest together is because to be able to really respond appropriately, we will need funds to do that, and now we have those funds. So what I would like to present, and I want to give Naomi some guidelines going into that meeting, but I'd like to present some things to the Ministry of Health and see how they react. The first thing I would like to present is to place a HopeCore coronavirus prevention station at each of their satellite clinics, first in our area, that is the catchment area for our school district. I am guessing that there's about 10 or 12 of those. I may be wrong, but let's just say there are 10 or 12. What we would do then is we would send a HopeCore nurse and our neighborhood community health volunteer to that satellite clinic with tank and soap. If they have a tank, we'll use their tank. If they don't have a hand washing tank, we will loan them a tank. I want to focus on the word loan. We are not going to give them tanks. We are going to loan them tanks for the duration of the epidemic, so that if we need in the future then, we can bring these tanks back and use them in our school system, as we're always getting new schools and tanks are breaking. Tanks are obviously something important for us to have. So again, we will put on loan a tank to them, and we will send a HopeCore nurse then to teach them how to set up that station. Obviously, the things we're going to do is we're going to do prevention on aerosol spread. That would be the importance of telling people if they're sick, stay home. If they have to leave their house, wear a mask, and to sneeze or cough into their elbows, not into their hands, and to keep away from social gatherings and to maintain 2-meter social distancing if they have to go outside, and if they're ill, hopefully they don't go outside at all, but only to a healthcare center, and otherwise stay home. As far as surface spread goes, probably the most important thing we can offer is hand washing with soap, preventing people then and instructing people not to touch their mouth, their nose, their eyes, that is their mucous membranes, unless they have washed their hands vigorously first. This is critical then, so that the virus, as you know, which can then stay on surfaces, is not spread to the mucous membranes, and therefore self-infecting an individual. Now, it's critical that we all understand why soap kills this virus. Some viruses, all viruses, are either DNA or RNA, either in a protein capsid or a fatty or lipid envelope. Luckily for us, coronavirus, influenza virus, rhinovirus that causes the common cold, they all have a lipid or fatty membrane surrounding them. Soap then rips apart that fatty membrane and kills the virus. Now, it's critical then that we tell people, one, to wash their hands with soap, and I like the fact of using detergent because they already have it in their homes. Whenever you tell poor people to have to go out and buy something, compliance rates fall because money is so important to people who are very poor. So I would like to instruct them to use what they already have, which is detergent. And in actual fact, the detergent in laundry soap is even stronger than what is in hand soap. And yes, it may dry out their hands, whatever, but it will kill the virus. Soap will also, bar soap will also kill the virus, as will soft soap. But soft soap is so expensive in our area, I don't think people will use it. But again, detergent I think is important. Now, it is absolutely critical when we do this hand washing education that they wash their hands with soap for a count of 20. 1 and 2 and 3 and 4 up to 20. The reason is that the dirt particles go away with exposure to soap very rapidly. But it takes probably 20 seconds for the soap to truly denature or rip apart the fatty or lipid membrane of the virus to kill it. So you can't just use soap for 5 seconds, rinse your hands and take off. That won't work. You have to leave it on for 20 seconds. And obviously people are not carrying watches, so the best way to do it would be to instruct them, wash their hands with soap, leave the soap out on the hands, rub vigorously for a count of 20. 1 and 2 and 3 and 4, okay? So that's going to be critical. We will then, in these satellite public health centers, provide soap as well as tanks if necessary, and the education for the staff at those clinics to run the clinics after we leave. The plan would be to have our nurse, HopeCore nurse, go to these clinics for at least probably 2 or 3 days to be sure that they're functioning correctly and that we have trained the Ministry of Health people correctly. Again, this is the trainer of trainer models. After that, at that point, the HopeCore nurse will leave to go train somewhere else, and the community health volunteer for that neighborhood will stay and be our eyes and ears to be sure that it is truly being done. That is, that somebody is educating these people and that there's truly soap and hand washing available out there. Now, it's critical that they set up a protocol, and the protocol would consist of having every patient then wash their hands before they come in and get the education before they make it to the waiting room. And then they have to wash their hands again with a count to 20 before they leave the satellite medical clinic. Now, there's 2 things about this. One, it tends to protect the clinic from surface spread of the virus. We would also triage any patient coming into a clinic of whether they are sneezing and coughing, and if they are, they immediately put them on masks. And the masks are very simple, and we can certainly make these. Ariana's been talking about it with our micro enterprise clients. They're just a rectangular piece of cloth with 2 earpieces. Now this is a child's, but for an adult, it should go over the nose and underneath the chin. Very easy, simple concept. Some of our people or a tailor in the community could make 100 of these in a day very easily. Also, after they've been used, they can be washed, and again at the clinic. And remember, as the detergent will kill virus on the hands, it will kill it in the mask, the same way it kills it in the hands. So you don't have to soak these things in bleach. You don't have to iron them with a hot iron. You just have to wash them in a good laundry detergent. So we're going to be doing that in our satellite medical clinics to have both the educator and the patients, particularly of coughing and sneezing, wear masks. In our stage coronavirus prevention centers, I don't think necessarily our educators need to wear a mask. It's very hard to talk particularly in a noisy area with a mask on. But I'm willing to be flexible about that. If our people would prefer to wear a mask when they're in the field, they should. But remember, when we educate, whether it be at the health center or in the stage areas for the matatus, we always want to do it outside with social spacing. Hopefully the long rains won't get in the way, so we will be able to educate outside and keep good social spacing and decrease any risk of infection. So this then becomes critically important. So education, good education of what to do about the virus, good education on hand washing with soap for a count of 20, and then working with the employees of the public health clinics to be sure that they continue this when our nurses leave. And then our neighborhood community volunteer, they will be responsible for making surprise visits to these clinics and being sure this is being done, that the education is being done appropriately, and that soap is with the tank. So that, Naomi, is what I would like you to present to the Ministry of Health. If they already have tanks, which they may do, then we would obviously just supply soap. And again, we only loan the tanks. We do not give them tanks, so that in a later date, if they're not using the tanks properly, we can take them back and use in our school facilities. So again, we will loan tanks, we will not give them tanks, and they have to know that up front. So that is the satellite center. So I'd like, Naomi, you to find out for me how many are in our school catchment area. I would like to cover all those for sure. You are authorized to tell them we will do that for all of those centers, right up to 20 of them, if they're 20. Then the question comes, what are we going to do with the rest of the county or the rest of the area surrounding us, but still in Tharaka Nithi? Well, one thing is that I would like to cover any hospital that does not have a tank and does not have soap with appropriate tanks, and again, an educational station outside of the hospital where every patient coming in would be required to wash their hands, to attend the education, enter into the hospital, and then have to wash their hands again as they leave the hospital. This is good, basic public health. And hopefully what I'm trying to do here is train the hospital and the hospital staff of the importance for them washing their hands and the patients washing their hands. Obviously, masks, again, are important. I'm going to let the hospital, at least at this point, either buy their own masks. Now, if we do have to buy masks, I'm very happy if we can buy masks from our own micro-enterprise clients who are making them, because then in some ways we're buying from ourselves. But in general, I don't want, as you know, I don't want to give them a fish. I want to teach them to fish. And I would like the hospital to buy their own gloves and their own masks. We will provide soap, at least initially, if we have to. And then the plan would be that the protocol would be that the hospital would take it over. I think initially, Naomi, you should see if we provide the tanks and the education and set up the station, that the hospital supply the soap. If that's not going to work, considering the acuteness of this epidemic, I will provide soap for them to get this thing going. But I think you're going to find that the central government is all of a sudden going to see the importance of soap and begin to provide soap. So I think what we're going to talk about on Monday is, one, putting a coronavirus prevention station in partnership with HopeCore in front of every public satellite health clinic in our area, and maybe outside our area, depending how many there are of those clinics. And Naomi, you'll find out for me. The other thing we will do is, if there are hospitals in our area, like the one we've already done, that desperately need tanks and soap, we will set up an education center outside of those hospitals. That will obviously require transportation and petrol, and now with the $27,000 US that we have in our war chest, we can actually accomplish that. So we want to be very aggressive, and we want to be very, shall we say, high visibility, if you wish, in the fight against this particular epidemic. So I will be calling and talking to Naomi this weekend before she goes into the meeting on Monday, but I wanted to be able to tell her what I'm thinking about, what we can authorize. And I think, Naomi, depending on what they come back to you with, you may then want to come back to me with other things. If they push you for things that you do not want to do, then what you should simply say that we have very strict regulations from the donors for what this money can be used for, and that you have to clear it with the medical director, namely me, before you can make any decision. So you can always then blame me for anything you do not want to get involved in. So we want to be very strategic here, but we want to get this job done. And then once we've gotten through Monday and seen what our responsibilities will be and what our financial responsibilities will be, then we will look out into the community. How are we going to take these coronavirus prevention stations, and how are we going to spread them around our area in the public areas besides the stages, how many we're going to do, and that will be then a discussion for our next video. But I would like to again emphasize the fact that in the last 48 hours, basically, we now have a real weapon to be able to go out and to fund what we need to help fight this epidemic in the Chagorria area. We will talk again soon.